My story is I was a PGY5. Apparently everything happened in my fifth year. I was a PGY5, and this story, some people have heard me tell this story before, but it's such a special story. I was There's a gentleman who was working at work again. Bad things can happen at work. Who fell into a gigantic mixing machine, and it was one of these really really big mixing machines, and it turned on, and it kind of caught his arm, and it kind of twisted and mangled his arm. And again, lots of blood loss, lots of trauma. And he came to the operating room, and my attending, a gentleman by the name of Deepak Narayan, who is no longer with us, unfortunately, but was just an amazing, amazing surgeon. Ortho came in, and they kind of put this hardware, these kind of outside posts to kind of hold the bones roughly in place, and said, "You guys should just amputate this guy's arm. We don't know why you want help in this. This guy's arm's never going to work again. It's not salvageable. There's too many things that are injured." And Dr. Narayan, I won't bore you with kind of each little surgical procedure, but it involved microsurgery, it involved distant flaps, it involved little tiny nerve reconstruction. It involved really big proximal nerve reconstruction and blood vessel reconstruction and muscle coverage and bone management and tendon management. And it was again, no embellishment, no exaggeration. It was 26 hours of surgery. And there are definitely long operations and these types of heroic things. But what I remember really clearly about that is Dr. Narayan and I, we each separately, but we each took two 15-minute breaks for the entire 26-hour case. And the guy had a good outcome. His arm was saved. He used to write Dr. Narayan Christmas cards every year to thank him. But I remember coming out of that room and saying, wow, this is what it's about. I've been doing this for 5 years. I am hard as steel. I can do these amazing operations and just have all of this, intense endurance. And I'm just super strong, which is that was in the old days, that was kind of what they really emphasized. Aside from, being smart and creative and thoughtful and dedicated to your patients, it was a lot about, how much pain can you tolerate? And I remember, Narayan said, we'll go round, go take care of whatever's going on the floor. Cause it was still the old days, 26 hours you weren't done. And so I did that. And he's like, but after that, go home, and then, we'll see you in the morning. And I went home after that, and I was exhausted. I was done. I'm like, I can't make good decisions. I could barely get home. And I remember I came in later, and I had learned that Dr. Narayan had actually, after that 26-hour case with two 15-minute breaks, he had actually held his normal clinic, and then that night operated again. And it was one of those moments where I was like, wow, it's great being a plastic surgeon, and it's great seeing how far I've come. But you kind of look back and you're like, man, there's still so much to learn and so much to do. And it's just really a really incredible, humbling moment about the level of dedication that sometimes the older generation and the younger generation too, but just plastic surgeons as a whole really put into their patients. It was a very, very special moment. It was really a wonderful opportunity to be able to help somebody.
That's a great story. And it really just highlights, I think, some of the stories about what people see is really the tip of the iceberg. And there's really so much underneath as the foundation that has led to being able to provide, good, consistent care and really taking good care of patients. There's just so much underneath that has led up to that point.
Totally. And patients should expect that. They should expect that that your surgeon has that level of dedication, that level of experience, that level of breadth of knowledge. It doesn't mean that things are always going to be perfect. It doesn't mean that someone with all that experience, that you're not going to have something that you may have to try to revise or make better at some point. But what it means you're really hanging out with people who have the best experience in the world and have the most knowledge and are really experts in their field, which is what every patient should expect.
The patient might be stressed or nervous, but
sure,
the surgeon shouldn't. The surgeon shouldn't.
The surgeon shouldn't. Exactly. And one of the things that you and I have joked about this a little bit before, but one of the things that I find always interesting, as president of ASBS, I've had the opportunity to meet just thousands of plastic surgeons, both in the US and both internationally. Again, amazing privilege. But one of the things that I think is always true is when you're seeing someone operate or you're seeing someone interact with their staff or their patients, how do they behave? Do they get stressed out? Are they nervous? And I always kind of tell the OR nurses, I'm like, surgeons that yell in the OR and kind of lose it are surgeons that are insecure with their own abilities. And it really takes experience and time and a really good training program to come, and sometimes a special person as well too. And I think that that's kind of what you've demonstrated, and one of the reasons we're really excited about having you here. So, well, we're going to probably do a round two at some point, but we just wanted to give you guys just share some old stories to kind of talk about, and just, being a plastic surgeon, it's a huge privilege. Part of it is you get to work with really wonderful, really smart, talented people. Part of it too is we're able to really provide kind of really great care for patients. And when we tell these kind of war stories about how hard it was, or the suffering, it's really because we want to we want success stories for our patients. We want our patients to be the heroes. So